So PTTrack is really near and dear to my heart, and the reason being is my mother had gone through some physical therapy after a knee replacement, and it did not go well. So this is really what the product is about. It came out of a startup weekend here in Sacramento, and this is our team. And what it is, basically, is it's a wearable and an app that is a solution for monitoring home and remote physical therapy exercise programs. And it eliminates costs because it saves insurance companies money, and of course the patient, if they're more successful in their physical therapy, they're going to be more healthy. So we want to eliminate return hospital stays is mainly the main thing. So we've done some research and found out that actually for physical therapy, home exercise programs, and remote exercise programs, only about 30% of the people are compliant with their programs. So that means 70% of the people aren't, okay, which is a huge number. And because of that, people suffer with poor patient outcomes. They end up having to pay more in co-pays and things like that as the patient. Physical therapists are open to lawsuits for their home exercise physical therapy professionals. And then insurance companies pay more because they have to readmit the people to the hospital if it doesn't go well. So I was just kind of looking at, this is just the general overall physical therapy market. Right now, 9 million people in the US have physical therapy in 1 year, which is a lot of people. We decided to focus on our minimum viable product of knee replacements and knee injuries. And just to give you an idea of the amount of knee injuries, almost 800,000 knee injuries a year, and 600,000 knee replacements a year in the US alone. That is projected to increase to about 3.2 million by 2030. So this is just a basic general idea for launch and pricing. So initially we were going to have the patient pay for the sign-up fee, a minimal monthly fee, and usually most physical therapy time is about 2 months. And then also per patient for the physical therapist for their monitoring through their app. Once we have industry adoption where the insurance company with billing codes, then we're going to be charging about $70 flat for each treatment course and have it a regular part of a treatment course along with the lease of the wearable. So this is just kind of an idea of patient projections for the next 5 years. Of course, as we're starting out, we have a low number of patients, and then as insurance companies adopt and we get the insurance codes should go up. And this is for revenue projections, goes the same way. So basically, of course, we're not going to be making money right away at first, but we project about $4 million a year just with knee replacements alone. Now, as we go along, we may be able to add other forms of physical therapy to our monitoring suite, if you will, and that would increase the revenue brought in too. So our competitive landscape, just so you know, we've kind of looked around what else is out there. Right now, there is nothing that automatically tracks or monitors accuracy for physical therapy at home. Most of the time, it's just manual, write it on paper type tracking, if there is any at all. A lot of times there isn't, okay? So I have some people added to the advisory board, have people adding to the team. And basically, what my summary next steps are is I would like to add more advisors and team members, complete the development phase and begin prototyping, and then once we have that and a solid product, get a insurance billing code, get approval from insurance companies to begin billing for it, and then we would be looking for probably insurance company investment arms or other investors at that time. So that's PTTrack.
Thank you. So, as always, you kind of a little bit stole my thunder, but what can we help you with more specifically?
Okay. Well, as I said, right now it's just, I'm looking for advisors and, people to help participate on the team who are passionate about solving the problem, really. Yeah.
Advisors in what?
Business, investment, just,
PT also, or?
PT also, basically, medical.
Reimbursement.
Reimbursement, yes, that'd be good. I need some people who can help me with billing codes on how to get reimbursed. I mean, that would be huge, yes. So, things like that.
I've never had a knee surgery, so at the beginning of presentation, I didn't understand exactly what the app did.
Oh, okay.
Until you went to like the competitive landscape, and I'm like, okay, what do the competitors do? And so
Okay.
I had, if you could kind of more clearly explain what the app does
Okay,
at the
okay.
beginning, because I didn't know.
Okay, well, thank you.
I'll jump on that one and say that, it was clear as we got to the end that this is more, you're kind of in concept/launch phase.
Right.
It's pre-physical product or whatever,
Right.
you haven't designed it, but showing, maybe early on that this is what we think it's gonna look like, even if
Right.
it's just a little graphic and it looks like a Fitbit, I don't know what it's gonna look like, but.
Right.
I think that would be helpful in
Okay.
just setting the stage. It doesn't have to be detailed, it doesn't have to be like, it could end up being totally different once you do go through the design
Okay.
phase.
Yeah.
But from the beginning, just being like, look, this is an idea, we're still in the concept design phase, this is what we think it's gonna be, here, let me tell you why this is important, and you jump into the problem and so on and so,
Okay.
yeah. I think
Thank
that would
you.
be really helpful. Thank you.
Okay, well, that's good, that was good. Yeah.
Just a comment, as you understand that not everybody understands what it is, like I get it, but just to iterate that it's personal therapy track. Like
Yeah.
if I was like, how many T's are in it, I'm not sure, so if you say that when you say it, I know you're
Okay.
branding so people can kind of get the shortness of it, but to
Right.
understand exactly what it is, and that's the setup, so like,
Physical
it's about
therapy
therapy tracking.
Okay.
And people kind of get the idea even if they've never had to experience anything.
Okay,
So true, yeah.
thank you.
I like it a lot. I think my mom just had knee surgery. She lives in Louisiana, I'm here in California, and so I like the idea. I know that she didn't walk away from her therapy with anything that she had to
Yeah.
analyze. I measure everything, so I would ask her in the phone calls. First of all, she's looped up. But
Yes.
like, okay, so what are you doing every day? What's the track to
That's,
get
yeah.
on recovery? And so
Yeah.
I think it's a great idea. I like that you show that how it integrates with insurance billing.
Right,
Because I think there's a huge gap, like you said,
Right.
and there's a cost that can be reduced to all of us
right.
if we can fill that gap with
Right.
some measurable exercises and making sure that people are walking through the process. I'm like, I want to know how it looks. I want to know what that thing's going to look like. Is it going to
Okay.
be something I wear around my neck? Is it going to be something, yeah.
It's basically more like a Fitbit, but it would be for the other extremities. Fitbit does not measure the things that you would need to measure, so actually there are other chips out there that do measure more, for accuracy and things like that, better than this would. We did have kind of mock-up of the apps. I didn't think to put them in there, and probably should have, of just, this is what the app screen is going to look like for the patient when they're doing their exercises. Basically because one of the people that I talked with, who was a mentor from another academy that I went to, he had been through knee replacements, and he said, it's hard, and anything you can do to the encouragement, like, oh, you filled in all your circles, or whatever it is, so that the person who's going through it is going to be more encouraged to keep going, rather than get depressed and stop, okay? Which is, the thing we don't want, basically. So
is there a networking feature on it? Because I would love to check in on that and say to my mom, hey, good job, keep going.
well,
this evening."
that actually
down the road.
would set it up so that the physical therapist would have access, and that if your mom wanted you to, you could have access, because
Yeah.
it's
Oh,
got
for sure. It's like back off.
It's that whole HIPPA compliance thing.
I'm 70, leave me alone.
Yes, well, and the thing is, we planned with that in mind. So, the data is going to be in a place where it's HIPAA compliant. Ideally, at some point, with the idea of feeding it back into a hospital system like Epic
Right.
or something like that, okay, which a lot of the hospitals use just to run all their whole business and they're doing all of that stuff, doctor stuff, so, yeah.
So I work in telemedicine with the elderly. I
Okay.
find that my position is mostly to set it up for them because they
Right.
don't know how to use the technology.
Right.
Do you have a plan on like a class or an introduction to?
Well, you know, initially what I was thinking is, because some elderly people, they don't want to mess with the technology. But if all they got to do is wear it and not think about it, that makes it easy. So I wanted to have that as like an option, okay? And then if they want that app, okay, the physical therapist can go through, set it up for them and just kind of show it to them. But they don't have to have it. So because, you know, it does tend to, if you're not familiar with technology and you're in a stressful situation already, maybe you don't want to deal with that, which I totally can understand as well. But I think for the physical therapist to have the app and to know, is the person doing their exercises as prescribed? Are they performing them well? You know, and then if they're not, being able to check in with them, call them and say, I noticed you're having trouble doing your exercises. You know, is there a reason for it? Maybe they're in a lot of pain. Maybe their pain meds need to be adjusted. I mean, there could be a lot of things. And right now, the way things are, there's no visibility into that. So once the patient's home, you're just expecting them to do this. But if that's really happening or not, we don't know, and chances are it isn't, you know, as from what we can see from the statistics. So anything we can do to make it easier for the physical therapist and ultimately the doctor to serve the patient better by knowing exactly what is going into their therapy would be helpful, you know.
Yeah. So after what you said, what I was wondering is are the elderly actually the people that you want to target right now? Or should you target some that are more tech savvy? For example, there are a lot of athletes, a lot of runners that do have knee injuries, and it's a younger demographic that
Right.
could be more comfortable with the technology.
Yeah.
So maybe should you target them first and then move on with a more proof concept to the medical industry?
I know that the range of age for most knee replacements, because I did a little bit of research on it, is like 50 years old and up. So you know, that age range, I mean, some of those people are comfortable with technology, but the older you get, the less likely that is. So I don't know, the answer is I don't know that one, but it's something I'll think about, yes.
Two things. One, I liked that you opened with a personal story because then I feel like it kind of grabbed me like, oh, this is, I was more interested. And also going off of her question, I played college basketball, so I know a lot of people that had knee injuries and it was mostly ACLs.
Yeah.
But I know this would have been extremely helpful for training staffs and along with coaches just to make sure they know you know, the progress of their players, making sure that they can hold them accountable, saying like, okay, she's doing her exercises, like my boyfriend tore his ACL and it was hard, he was discouraged, like really discouraged playing, so it was, I think a lot of this would be extremely helpful.
So targeted for a younger market, maybe.
Well, that's not knee replacements, it's a lot of ACLs, but.
Yeah. So, time?
No, you got plenty of time. I had a question. I think one of the things that concerns me a little bit is the business model.
Okay.
Where you're asking the patient to spend
Right.
more money after already spending a ton of money on the medical costs.
Right.
Right, so like obviously insurance long-term I think is
Right.
a great play, but to add on to what Natalie was saying, you know, maybe there's this interim solution where you can go after, you know, colleges with the training department or other groups that can help you, that will cover the cost
Right.
for their patients. You know, I would have the same concern if you're going to like the physical therapy office
Right.
and asking them to take the cost.
Right.
Because not only are you asking them to pay more, but you're probably reducing their billable time,
Right.
Because, you know, you're increasing, so that you have a unique kind of model or marketplace. And I would encourage you to think outside the box and how you can get people to pay for it that aren't the customer or the physical therapy office.
Yeah, that's what I was thinking too, so.
So more of a comment, I guess, than a
Yeah,
question.
no, I like that. Like I said, I think you're right. I probably need to adjust the business model. I'm seeing that. Yes.
So, building on what Ryan said, and then just my experience working with med tech companies is
Mhm.
that reimbursement, getting the insurance companies to recognize it, getting a code for
Mhm.
this, that is a huge piece of
Yes.
your strategy, that it probably needs to come sooner rather than later.
Okay,
And you don't need to have a lot of people already using it to get the insurance company
Ah.
to, they don't go look at your market, they look at the value of what you're doing.
Oh,
So
cool.
I would say in terms of seeking a mentor,
Right.
that getting educated about the reimbursement process will
Mhm.
probably get your
Yeah.
product to market first. And I also wanted to say, my 79-year-old father would be very comfortable using this technology.
Yeah.
So,
Yeah, it depends on the person.
right.
I know for my mother, probably just wearing the wearable would have been fine, you know? It might have stressed her out to try and figure something new out. But other people, they like that. So it just depends on the personality as well.
Yeah.
They've used computers, people in their 70s and 80s.
Yeah,
They have.
They do.
They do. I
yeah.
agree, yeah.
So my son's in physical therapy right now because he broke his hand in 3 places.
Ow!
Yeah. From my perspective, one of your main business drivers is her.
Yeah,
Her mother, to be able to monitor what my son's doing in his physical therapy. I know you
Right.
talk about, not being careful with that, but just having the physical therapist know what's going on.
right.
Mom and dad, family members, and there's a whole community out there that supports each other when you have tragedy and when you have stuff like this. They're powerful. I'd pay $100 right now if this was up and running for my son.
Really?
Yes.
That's great.
And I think there's
Okay.
a lot of
Very
people
motivated now.
that would do that. So don't
Okay.
miss tapping into that group
Okay,
because they can drive your entire business model.
Right.
Even though that's not what you're focusing on,
right.
but there's always sometimes in business a side channel to
Yeah.
hit that
Yeah.
could be a bigger driver than insurance companies and physical therapists and doctors and the patients themselves,
Right.
because I would pay it. And I'm not
Okay.
the patient and I'm not any of those in your model.
Okay,
But I think
cool.
that's a powerful group.
Okay, thank you.
And just following up, that resonates a lot, and I feel like you go to a dentist's office and they sell the Sonicare or whatever,
Right.
but it's not part, the dentist isn't suggesting it, like, here's a thing you
Yeah.
might want.
Yeah.
I can see, like, as a parent, if you walk in, like, my kid just broke, like, needs knee replacement, this is a no-brainer for
Right.
I wonder where those people are. They're at the physical therapy office, where else are they?
Right.
They're online.
They're
There's
online.
communities that
Online.
support each other with, yeah.
What's the price point you're thinking about?
Well,
Because he said $100.
I
Which were you
know,
thinking?
I was going for 70, but then you have to lease the wearable too, so that's 50 to lease.
You know, whatever it is.
Yeah, but
Yeah.
it feels like there's just a whole lot more refinement you could do
Right.
with the business model itself. These are
Okay.
some great ideas, because we've
Yes.
just come up with 2 other revenue streams that you didn't
That's
even
great.
mention here.
And you know, they wait on insurance companies, and so you can
Yeah,
have
and
those
for
smaller
somebody
ones
knows-
of, like, you could have 3 or 4 if you prototype and sell
Yes.
tomorrow.
Yeah.
That's it. All
If
through.
it's $70, you can start selling it in CVS. Like,
Yeah. That's true.
Yeah.
That's true.
I'll throw one other suggestion out there in terms
Okay.
of not necessarily a revenue stream, but a source of capital. A lot of insurance companies have venture arms looking for
Right.
things just like that, which
Right.
is a door into getting your, code approved
Right.
as well. So you may
Right.
want to start networking and reach out to some, the State Farms, I'm pretty sure State Farm has a venture capital arm. I don't know about the other ones, but I see companies like this get funded all the time, like pre-concepts, right? It's like, this is what I want to do, like the market
Yeah.
is so obvious for the
Right.
insurance company. If they could, I think you said 50 to
90%
90% savings,
savings, that's a lot.
they
Oh,
will
yeah.
probably write,
They go
if
crazy.
you get in front of the right person, you could have a
Right.
check for 100,000, because they
Yeah.
have, anything under 100,000 is like, doesn't require approval
Okay.
to take the next step
Okay.
for the
Great
venture
point.
capital.
So I'll take a look, yes.
So I'd suggest another type of mentor would be someone who has experience in med tech sales.
Okay. So those 3, definitely.
We got time for a few more questions.
Do you have a time when you have to get a mock-up built? Figure that
At this
out?
point, I don't, no. I haven't, scheduled it as far as that goes, but obviously the sooner the better.
You will need one, right?
Oh, yeah. I have, we have a real basic one. That's just pictures. But
Yeah.
And then I also have one that it went in with the patent, because and that's a patent drug, which is different.
Did you mention that this idea just started in May?
Yeah, it just started in May.
No,
So
you
very
didn't
soon.
mention that, that's a good
Oh,
point,
yeah.
wow.
Yeah, so it's coming along slowly but surely, and as I said, it just, I could see that I need to have it together and require more focus here, which is great, yes.
So I think you guys brought up great points about like, okay, yeah, I pay $100, I would love to monitor my mom.
Yeah.
But the problem is though, is you reaching them.
Right.
Whereas I feel like, and I feel like you kind of got to focus on just the physical therapists and the insurance companies.
Right.
And so how many physical therapists have you talked to about this? And I think that's a question for everybody in the room. If anybody knows a physical
Yes,
therapist,
please, if you know a physical therapist,
Yeah.
intro.
But
But
I
I feel like you got to get on the phone and talk to like dozens of these people. And
Yeah.
because then you will be able to very quickly figure out where the path is.
Right.
And so instead of like, oh, I need to talk to the father of a kid that broke its hand or the daughter of a mother, it's like, I feel like you need to go like to the physical therapists that deal with hundreds of these cases, every month,
Yeah, well, we have a physical therapist that was originally on the team, is one of the reasons we pivoted actually towards physical therapy. We were looking at something else. So, and I've worked with her and then a few others, but I definitely, more is better, So, yes, if you do know physical therapists who are willing to try some new things out too, that would be great.
One last question.
I'll try it because we can get tough.
I'm going to send a question about the topic in terms of building your team. Is there a specific skill set or experience that you're looking for?
Well, definitely want to find somebody who's knowledgeable with getting medical billing codes and things like that, progress. I'm also looking for some tech people for development work. And then, the medical sales, or I think you said medical sales, yes. So, I mean, at least that, at this point, and then anything else, business-wise or health-related as well, in that health field, that would be helpful, knowledge of physical therapy and that kind of thing. Or if there's support groups and things that possibly could market to once we have something, to know those kind of things, which
Are you looking for a co-founder?
I may be, yes.
You're a one-woman team pretty much right now, right?
Well, yeah, what happened was the team, they had full-time jobs, and it was a commitment, and they weren't ready to make the commitment. So, which is, okay.
What's your funding at this point?
Basically bootstrap.
Oh.
So, yeah. So that's pretty much it at this point. And I feel like I need to have something before I can ask for a lot, but then going to insurance companies is probably going to be my next step, because I think that was probably the thing I was looking at.
That's
So.
good.
Thank you very much.
Thank you.